Hello, sound வச்சு கேட்டு பாருங்க. Hello.
Yes, ma'am. Yes, ma'am. You're audible.
Sharon is there?
Yeah, she joined, ma'am.
Yes, ma'am.
Kritika? Our mobile. Preeti, Kritika is there, ma?
Wait, I'll check. No, ma'am.
Yes, ma'am. She joined now, ma'am. She joined, ma'am.
Joined, huh?
Yes, ma'am.
Yeah, she joined.
Sir, okay, va?
Yes, sir, this is okay, sir.
Voice
Hello.
audible,
Yes,
audible.
it is audible, sir.
Yes, sir. Background is fine, sir.
Yeah, it's quite good, sir.
Okay.
It sounds good, sir.
Yes, sir. Yes, sir. Thank you, sir.
Yes, sir. Ma'am.
Sir, and கொஞ்சம் நான் பண்ணும்போது மட்டும் ஸ்கிரீன்ஷாட் எடுத்துக்கிட்டீங்கன்னா நல்லா இருக்கும் சார்.
Sure, sir. Sure, I'll take, sir.
இந்த யூடியூப் லிங்க் கொடுத்தீங்க, இது வந்து எப்பவுமே பப்ளிக் டொமைன்ல இருக்குமா?
You can, sir. Public domain. You can share to.
Okay.
Yes.
Thank you, sir. Yes, sir.
Yes. Ma'am.
Yes, Vinod.
Ma'am, both speakers are came.
Yeah, we
We'll
can
start
start
now.
off.
Yeah, thank you.
Good morning, all. I request the audience to switch on your video and to be in mute. We need your cooperation and support to make this virtual national conference into a huge success.
Thank you, Neha. Prayer is the key of the morning and bolt of the evening. With this, I call upon Ms. Kritika of second year CT to seek the presence of Almighty through a prayer song. Over to you, Kritika.
Prayer song. There shall be showers of blessing. This is the promise of love. They shall be seasons refreshing, sent from the Savior above. Showers of blessing we need. Mercy drops round us are falling, but for the showers we plead. Mercy drops round us are falling, but for the showers we plead.
Thank you, Kritika, for making a peaceful environment through your melodious song. With this note, day one session gave us a grand success. More than 250 participants participated through Zoom and more than 300 viewers participated through YouTube. A great virtual applause to the audience and the organizing team. Now, Triple MCHS proudly assembles Day 2 conference conducted through virtual meet. Well, Benjamin Franklin said, "Tell me and I forget. Teach me and I may remember. Involve me and I learn." It is an occasion like this we get opportunities to test a knowledge and understanding. We look forward to get opportunities to explore about what the best of our brain thinks about this very dynamic issue, safety measures, and good health during clinical practice. Now, I extend my warm welcome to our beloved principal, Dr. Deepa C. Philip, to give a floral welcome to our gathering. Over to you, ma'am.
Thank you, Sharon. Very good morning to one and all present here today again. I warmly welcome you all to the second day of the National Conference for Allied Health Professionals on Infection Control for Healthcare Professionals with the theme Safety Measures and Good Health During Clinical Practice. Let me take this opportunity to welcome our guest of honors for today. I warmly welcome and sincerely thank our guest speakers for today's session who have consented to spare a few hours to share their knowledge with us. I welcome Dr. Arun Kumar Subbiah, Assistant Professor of Nephrology, AIMS, New Delhi. Also, I welcome Mr. V. Venkatesh, Professor, PG Department of Social Work from Ramakrishna Mission, Vivekananda College from Chennai. I extend my greetings or welcome to all the faculties and the students from different colleges who are watching us through this online platform. Every year, we lost many lives because of the vast spread of the infections in the hospitals. So the healthcare workers has to take certain steps to prevent the spread of infectious diseases. Yesterday, we have seen what precautions we have to take as part of the infection control and how to keep yourself healthy with the good nutritious food. Today, I'm sure that you will be enlightened with safety measures and how should you keep yourself with good mental health. So I'm not wasting so much of your time. I thank everyone for your active participation and wishing everybody best of luck for your future. And I once again welcome all of you to this conference. Thank you, everybody. God bless you all.
Thank you, ma'am, for delivering a great welcome address, introduction, startup for today's conference and giving us an enormous support. Our national conference is also streaming live on YouTube. The link is posted in our mentoring groups. Participants, those who have any questions regarding this session may raise your questions by posting it in the chat box. Now I invite Mr. Vinod Kumar, Assistant Professor, Triple MCHS, to introduce our guest speaker, Dr. Arun Kumar Subbiah, as the speaker of this segment on the topic, Safety Measures During Clinical Practice. Over to you, sir.
Good morning, all. It is my privilege to invite our speaker for our second day conference, Dr. Arun Kumar Subbiah, Assistant Professor, Department of Nephrology, AIMS, New Delhi. He completed his MBBS in Chengalpattu Medical College, Chennai. MD in General Medicine in Jipmer, Pondicherry. MD in Nephrology, AIMS, New Delhi. MRCP and specialty certificates in nephrology in Royal Medical College of Physicians, UK, and many certificate courses related to the nephrology. He holds professional and society memberships in more than 8 nephrology associations. He is specialized for performing a special nephrological surgery and biopsy. Additional involvement in participation in several seminars, journal club, researchers and lectures. He has been a part of author for nearly 25 medical books has been published. On behalf of organization team, I render a warm welcome to you, sir. Over to you, sir.
A very good morning to one and all. I hope I'm clear. My voice is clear.
Yeah.
Yeah. So very good morning to one and all present here. Thanks for the wonderful warm introduction. So we usually try to speak more about patient care and research in all our conferences. And most often we forget that what is more important would be safety, with patient safety and safety measures for us, which is going to help the patients again. So, and this we have understood more during the trying times in which we are right now, especially with COVID. We have understood how much safety measures are important to us. So it is really nice that the organizers in the Tribhuvan College of Health Sciences have chosen this wonderful topic and have hosted this national conference, which is going to help us to understand how we can keep us safe during our clinical practice, not only during this COVID era, but also following that. So I will start sharing my slides and probably we can get into the talk.
Sir, shall I?
Yeah, can I,
Yes.
are you able to see my slides?
Yes,
sir.
yes,
sir.
Yeah, fine. So in this talk, we'll be having a look about what is safety, both for the patient as well as for the healthcare workers, infections, about how they spread. I do understand that an infection control seminar was taken by Dr. Sham yesterday, and it was really nice. However, I'll be just giving a small overline so that we can understand how we can have make us safe during this period. We'll have a short overview about the standard precautions which we'll have to take for all healthcare workers. Some specific recommendations, mostly focused on dialysis and other invasive procedures, and also about how you should educate the patients and the caregivers, because it is this education is going to help them to prevent infections or to take the necessary safety measures for the future. So the importance of workplace safety and health worker safety was stressed by the World Health Organization. And as you can see in the talk, which on the World Patient Day, which they had celebrated on 17 September 2020, they had stressed that a safe and a supportive work environment is more important to safe patient care. So this probably we understood only after COVID had come up. This was because though the healthcare workers, they make up only 2 to 3% of the entire population, among those who were affected with COVID, healthcare workers constituted around 14 to 35% of those who were affected. And it was seen that nearly 1 in 4 healthcare workers had significant healthcare issues. So this made the various health organizations and the governments to develop a linkage between the occupational health and safety and to implement national programs for healthcare worker safety. They understood that mental and psychological well-being is very important, and all the healthcare workers have to be protected from physical and biological hazards. Apart from this, there is something with regard to psychological health also. I would probably deal about protecting healthcare workers from physical hazards only in this talk. Dr. Venkatesh should probably be dealing about the mental health care issues later today. To understand what safety measures we have to take, we should first understand what is needed for infections to spread. So for an infection to spread, we need 3 components. One would be a source of the germs. It can be any bacteria, any virus, as the present COVID viruses. A susceptible host, anyone who can get an infection from the germ. So someone who does not have the infection but is more prone to develop an infection, he becomes a susceptible host. And a method of contact between these two, between the source and the host. This can be either by means of direct contact, can either be by means of droplet or by airborne transmission. So as you can see, droplet and airborne transmission are the most important methods of spread for respiratory viruses or bacteria. The most important thing would be the droplet transmission, which can happen with flu, or the airborne transmission, which is more common with tuberculosis and other organisms. So how is droplet and airborne transmission different? How is droplet and airborne transmission different? So droplet transmission means there is the cough and the sneezes. They develop droplets of saliva, which then spreads locally. So droplet is basically when you are there in the same room with a patient who is affected, then we tend to develop the infection. The particles are usually slightly larger, around 5 microns in size, whereas in airborne transmission, the particles which are produced because of either talking or by coughing, they are suspended in the air and they are there for a longer period and can go even outside the room. So this is what which happens with tuberculosis usually. The question is what happens in COVID infection, because COVID is usually the topic of concern now. Though COVID is usually transmitted by droplet only in most of the cases, they are saying that airborne transmission has also been documented, especially in aerosol generating procedures. And to understand how much small these droplets or airborne particles are, we should understand that the human hair is around 60 to 120 microns, whereas these droplets or airborne particles are around 5 microns. So you can understand how small these particles are. And this is precisely the reason why we won't be able to find out what would be the mode of transmission of all these infections. So the second most important, or the one which we usually see in the healthcare setup without respiratory infections, is the contact transmission. So just by touching the one infected patient and by touching another patient who is not infected or any other patient who visits the hospital, we can transmit infection. And this is the most common mode by which infections is transmitted by healthcare workers. So that is why the safety measures have to be taken so as to even prevent infection for us as well as for the other patients. So now that we have understood how infections can happen in the healthcare scenario, we as healthcare workers, we should understand and follow the basics of infection control so as to prevent transmission of infections. So for this, we'll have to take some standard precautions. By means of standard precautions, we mean that we assume that almost all patients with whom we come into contact with are infected. We have to assume that, and we'll have to take certain standard precautions, which usually was given by the CDC and report disease containment. And this has to be taken so that infection can be prevented. Apart from this, we will have to make sure some extra measures are taken in some extra scenarios, just like the COVID pandemic right now, and also in certain areas where the contact with blood and body fluids are more, just like in hemodialysis. The reason I'll be stressing about hemodialysis is because I was told that there are a number of dialysis technicians in the course one, and of course I'm a nephrologist, so I'll have to speak more about it. So with regard to the standard precautions which the healthcare workers have to be taking, it would be that you assume that all patients are infected for all transmittable infections, and you take the basic precautions for hand hygiene, for personal protective equipment, and when administering drugs, injections, or when taking sampling. So this has to be taken care of. So what are the most important standard precautions? The first one would be the hand hygiene. So you should understand that soap is a very good component of hand hygiene, and whenever your hands are soiled with either blood or any body fluids, then you will have to use soap and water for a minimum of 15 seconds, preferably 30 seconds. And if at all the hands are not soiled, then an alcohol-based hand rub can be used. When an alcohol-based hand rub is used, you should make sure that there is at least 60% by weight of alcohol is there, so that it is effective for COVID as well as for other viruses also. And this is the most important way by which we can prevent the spread of infections. So when should you do hand hygiene? Two parts. So one, before you go to the patient, and two, after you go to the patient. So before you go to a patient, before you touch the patient, before you inject or infuse a medication, before you take a sample, or before you cannulate a fistula or a graft or access a catheter in cases of dialysis patients, or even a central line catheter in cases of transplant patients, then you will have to perform your hand hygiene. And you should remember that this hand hygiene procedure, it has to be done between each patient and before each station of the patient. And after you touch the patient, after you come into contact with any of the body fluids, after you touch the medical equipment, and after you remove your gloves, you should make sure that you perform the hand hygiene. So it should be done both before and after contact with the patient. So this is just an image for us to remember when and all we are going to do a hand hygiene. So before you touch the patient, before you do any procedure, even if you're going to do a sample collection, if you're going to do an ECG, if you're going to do prepare the patient for dialysis or prepare the patient for any surgical procedures, you should do a hand hygiene. After you are exposed to any of the body fluids of the patient, even if it is a plain Foley's bag, urinary catheter bag, then also you should make sure that you sanitize your hands. After you touch any patient and after you touch his surroundings, even when you are in contact with the patient bed, the patient trolley, or the patient's wheelchair, you should make sure that your hand hygiene is always maintained. Apart from this, the next thing would be about using the personal protective equipment. So what constitutes a personal protective equipment? So we have started using this terminology only after we started encountering the COVID patients. When you're going to wear the complete PPE kits, what you see, the complete white sets. However, we should understand that even a simple gloves, a gown, or a face mask, it constitutes a personal protective equipment. And whenever we are going to come into contact with a patient, if it is going to be only by speaking to the patient, we should ensure that a face mask is there and probably a face protection with a face shield is there. And if you're going to touch the patient for any reason, a glove should always be there. And for all other procedures, where even for a sample collection, where there is a possibility that there can be some spillage or splatter of blood, then we need to make sure that a gown is worn by us. So, and make sure that you change your gloves even when you shift in the same patient from a contaminated body site to a clean body site. Consider that you're taking a sample from a suspected infected site, be it a swab or something. And then you will have to take a swab or a blood sample from the patient from another site. Make sure that you change the gloves and sanitize your hand before that. Because even within the same patient, you can cause cross-contamination from an infected site to a non-infected site. And whenever you're shifting the patient or you come into contact with any patient surroundings, change your gloves. For every single patient, change the gloves, because you will never know which patient is infected and which patient is not infected. And make sure that safe injection practices are followed. This is especially important when you're going to access the bloodstream directly. So this is usually not done by most of us. Still, we need to make sure that we follow the safe injection practices. The same concepts would apply when you're going to do sampling. And whenever you're going to access the injection ports, be it a simple venflon or a central catheter to take samples, then also the germs can get introduced, even if you're going to take it from a sterile container. So make sure that the standard precautions are always followed, and use only one syringe for one patient always. Do not change the syringe. Do not use the same syringe for multiple patients, and do not use the same syringe even multiple times for the same patient. Because the moment you're going to remove it from the patient, then you're going to reintroduce it, you're going to reintroduce infection. And for every single device which you're going to use, the device, the instruments, the personal protective equipment should be only one. And whenever you're going to do the procedure again, all the hand hygiene and the personal protective equipment has to be changed. This is the only way we are going to protect both ourselves and the patient. And whenever we are going to work, what we should do in our work area, we need to separate our work areas into a clean area and a contaminated area. So it is a clean area where we are going to prepare our things. Basically, when you're going to do any procedure, when you're going to take even a simple blood sample, before you take an ECG, you're going to make sure the leads are there. All these should be made ready in the clean area. And once it is made ready, it should be taken to the patient care area. It should be used. And then once it is used, it should not be brought back again to the clean areas, but it should go back to the contaminated area. So always divide your workplace into a clean and a contaminated area. And even if some supplies are not being used, do not bring it back to the clean area. Keep it only in the contaminated area, from where you will be able to dispose it off easily. And you should not store the medications with the same place where the blood samples or the equipments are there, where it can be used. And you should have the clean area should always have a place where you can perform a hand hygiene, as you can see in these areas. And even the simple nursing station is a contaminated area. So if you're going to collect some blood samples or something, if you're going to go to the nursing areas or nursing stations to keep it, make sure that you don't carry it back to the labs yourself. Have a separate area for that also. With regard to the supplies, all the things which we use for a single patient should be there. It should be used only for him. So if you're going to take 2 syringes and you're going to use only one, you should not bring back that one syringe and use it for the other patient. You should allow it to be used only for that patient again. So either you should clean it, disinfect it, and then take it to the common area, or you should make sure that it is disposed. Because even a very simple method of just taking it to a patient's area and bringing it will cause it to get infected. So that is why we should be sure about it. And do not change between patient areas or stations directly. And whenever we are going to carry any medicines, or whenever we are going to carry any syringes or alcohol swabs, make sure that you don't carry it in your pockets, the lap pockets, because we tend to do it usually that we keep everything in our lap pockets because it's easier for us to take it and take samples and other things. So whenever you're going to access your pockets, you're going to transmit infections to yourself, one, and also to the other patient again. Because even if you're going to use a glove, once you touch the patient and then touch your lab pocket, you're going to transmit back to yourself. So be careful that you don't store all these things in pockets and you don't use it again and again. So some points about hemodialysis, especially for the dialysis technicians, would be that dialysis patients are more prone for infections. This is because the catheters are directly in line with the blood streams. The patients have a weakened immune system. They usually come to the hospital and have longer stays in the hospital. One thing which should be remembered is that whatever I'm speaking for dialysis patients don't apply only to the dialysis patients. It also applies to other patients who have a weakened immune system, especially if you're going to work in a place where there is a bone marrow transplant or where there is an oncology unit. There are also the patients are going to have catheters, Hickman catheters for a long time. They're also going to have a weakened immune system. If you're going to work in the ICUs, patients are going to have catheters for a long time. There are also patients that are going to have a weakened immune system. So the same concept which appears in dialysis patients would be the same which would appear in any other vulnerable group: oncology patients, cancer patients, transplant patients, bone marrow transplant patients on the ICUs. So the same principles have to be followed in all the cases. And the most common infections what can happen would be blood-borne viruses, hepatitis B, C, and HIV. Usually with regard to HIV, we have become so very careful that usually we don't see them transmitted by healthcare nowadays. However, hepatitis B and C are still very common. They are an important cause of hospital-acquired infection, important cause of CLD, both in India and worldwide. So that has to be remembered. And whenever there are catheters, there is a risk of contamination and bloodstream infection, usually by bacteria, especially in vascular accesses, both in dialysis as well as in the ICU setups. And these bloodstream infections are so severe that around 25% of the patients tend to develop complications like endocarditis, an infection of the valves, which can be life-threatening for the patient. Apart from the fact that it can affect lives, it can cause significant cost constraints for the patient. It can prolong the hospital stay, thereby affecting the outcomes of the patients. So whenever we are going to come into contact with vascular catheters, either for sampling, for dialysis, or in the ICU, make sure the gloves and the personal protective equipment is worn properly. The vascular access should be accessed very safely. Once you remove the covering, the vascular access covering, make sure that a new gloves is used to access the vascular access. And whenever you're going to go to the access, make sure that the hand hygiene is done perfectly. A safe handling of the dialyzers or any other patient equipment by the bedside has to be done. The dialysis station has to be cleaned and disinfected between the patients on every visit. You should wear a gloves, both for your own protection, that would be more important. Whenever you're going to clean the environment around the patients, make sure that you wear gloves and you do hand hygiene before and after cleaning the area around the patients. And before initiating the dialysis, you should wear gowns and face protection. The same thing would be when you are going to initiate any other procedure which is invasive for the patient. The same thing should be done when you're cleaning the dialyzers. The same thing should be done when you're handling lab samples. So this is very common. Make sure that you wear a proper gown and a face protection. And whenever there is any spillage or it becomes dirty, make sure that you change the personal protective equipment always. And all the supplies of a single patient should be used only for that patient. And once used, it should be disposed of. So with regard to the dialysis access specifically, the site should always be washed. You should perform a hand hygiene. You should use a new pair of gloves and make sure that you use gowns and face masks so that there is no spillage of things. And once you finish cannulating or accessing the fistula, you should remove the gloves and perform the hand hygiene. The same thing should be done when you're going to remove the fistula. So when you're going to remove the needle from the fistula, you will have to wear a new pair of gloves. You should remove the needle and you should put the bandage, a clean bandage has to be placed over the fistula's insertion site at the decannulation site, and you should perform a proper hand hygiene. So if at all you're going to have a catheter, any catheter, based on dialysis catheter or an ICU catheter, they are also, before you access the catheter hub, the opening of the catheter, make sure that you use a new gloves. So usually in the ICUs, we try to take samples from the patient from their catheters directly. So make sure that apart from using the gloves to remove the dressing, when you access the catheter hub also, you should use a separate gloves. And when you are going to connect the catheter to any line or to a syringe to collect samples, then also you should use a aseptic technique, and you will have to perform hand hygiene after you do this procedure. The same thing should be followed whenever you're going to disconnect the syringe or the various blood lines from the catheter hub. You will have to use a fresh gloves, and you should make sure that a hand hygiene is performed. And once you see the exit site, you make sure that you are applying a clean dressing every time, and an antiseptic is applied to the dressing site. And then again, you remove your gloves and perform hand hygiene. So at every step of patient care, make sure hand hygiene is followed and a PPE is used so that you are safe. So with regard to the patient station, so though I have mentioned this as dialysis station, apart from the dialysis station, anywhere when you go near the patient or any procedure is done for the patient, make sure the proper cleaning and disinfection is done. So by cleaning, we mean that whenever there is a blood stain, a body fluid is there, or there is any other contamination, you try to remove it using a common detergents which are used. Whereas for disinfection, we try to kill the germs which are on the surfaces. For this, you use a hospital disinfectant like a hypochlorite solution. And you should make sure that a gloves is always worn during the entire cleaning and disinfection procedure. The same thing will apply even to the lab instruments which you are using, wherein patients' blood or other samples are being utilized. You should make sure that the instruments are clean and the area around the instruments are disinfected before you are going to go for the next day, always. And we should make sure that all the surfaces are wiped. All the places, even where the patient sits, has to be clean. So this is even more important once COVID has come, because we have understood that COVID does spread by contact, and hence contact precautions are important. So wherever the patient sits, even a dialysis chair, in case of sampling, a sample chair, when the patient comes for an ECG, the ECG trolley, all these have to be cleaned and they have to be disinfected before the next patient comes. An easier method would be that you use a disposable covering on all the ECG trolleys or the wheelchairs, and then it can just be removed once the patient goes, so that the next patient can use a different gown. Otherwise, we'll have to disinfect all the places where the patient has come into contact with, irrespective of whether they're going to have an active infection or not. And once dialysis is done, or once any procedure is done, anything with which the patient's blood has come into contact, like the dialyzer, the blood tubings, the dialyzer ports, they all have to be closed, and in a leak-proof container, they'll have to be transported. This is very important even for normal routine blood samples. One thing what you should remember during needle stick injuries is that they are quite common. Though we don't know the exact figures, the data is less. It is in general told that for every hospital which has 100 beds, there are at least 30 needle stick injuries per year. And every healthcare worker has a risk of acquiring at least 2.3 times. They have the risk of having a needle stick injury every year. And the cost because of this needle stick injury is more than 9,000 rupees per healthcare worker. And this was in 2005. We don't have data after that. Data is quite scarce. But this just shows that apart from the cost involved, the risk what the healthcare worker will have to be enclosed even during a simple blood sampling is very high. So this, hence you should make sure that safety measures are always taken by you. So always eliminate any unnecessary needle use. So whenever there is no need, don't use needles. Always use the needles which has a safety hub, a safety feature is there. And use safe work practices. Do not recap the needle. Have a separate place for disposing any sharps and all the blood contaminated or any body fluid contaminated things. You should have a safe method for safely disposing them always. And whenever you are exposed, either because of a direct contact or because of a needle stick injury, make sure that it is reported immediately to your superiors. You assess the infection type. What is the type and severity of infection? How much risk does the separate patient has? What is the source patient status? And then you take appropriate treatment, either for retrovirus, for hepatitis B, for hepatitis C. Make sure that a proper follow-up is done, and your counsel, the one who is affected is counseled about proper post-exposure prophylaxis always. The institute usually has a policy by which this is done, and this has to be maintained in the best possible manner always. So with regard to dialysis per se and also to other places, we should remember that all the patients, all the staff in the hospital, not only the dialysis staff, all the staff in the hospital need to be vaccinated properly. So the vaccination means the most important thing would be the hepatitis B vaccines. So if at all you have received hepatitis B vaccines, make sure that you check your antibody titers. If your antibody titers are less than 10, you would require a booster shot. So, and once you receive a booster shot also, make sure that you are able to recheck your titers. Make sure that you are always protected against hepatitis B, because that is something with which you can get protected easily. Apart from this, try to get the flu vaccine every year. The common Influvac vaccine, it's quite safe. It's an inactivated vaccine. Make sure that you get every year, especially those who are working in areas where there is aerosol transmission. Because a patient comes with a flu, the risk of you acquiring a flu is quite high. So make sure that they get the vaccine every year. And almost all the patients, especially in dialysis, you will have to make sure that they are vaccinated against hepatitis B, influenza, and pneumococcal. And whenever there is a closed area and the patients are going to come repeatedly, make sure that you do a testing for hepatitis B virus and hepatitis C virus and HIV virus routinely. I will not probably put HIV here, but you'll have to check all these three routinely, both by antigen-based testings as well as for serological testings. And whenever you're going to encounter a patient with hepatitis B or C, you should try to dialyze them in a separate room. Though nowadays hepatitis C patients are being dialyzed in the common room, hepatitis B have to be dialyzed in a completely separate room. And anyone, if you're going to care for a patient who is hepatitis B positive, make sure that you don't care for a hepatitis B negative patient at the same time. There should be a separate care provider for hepatitis infected and hepatitis non-infected patients always. And you will have to take all the precautions to prevent the spread of routine bacterial infections. So any patient who has an infected skin wound, which is not covered with dressings, make sure that you don't come into contact with it. Anyone who has diarrhea, make sure that if at all you come into contact with that patient, that you perform the hand hygiene before you go to the other patient. You will have to change your gown. You will have to make sure that any infected patient is not present close to a non-infected patient. The dialysis, we make sure that the dialysis stations next to it are free. If at all you're going to take sample, make sure that after you take the sample, the area is disinfected. After you take the ECG, the area is disinfected before the next patient walks in or comes in. And if at all there are anyone with respiratory illness, you should take care that they are dialyzed or any procedure is done at least 6 feet away from all other patients. So this is standard precautions what we tell for COVID right now, that there should be at least a distance of 6 feet between each patient or between the patient and the next patient, so that there is no contact of transmission of infection. And for all these patients, you should take care that there are no supplies which are shared. That is important. So a couple of words about COVID precautions. Though we are at the end of the COVID pandemic still, we need to be certain that we follow these precautions at least for this year till we are all vaccinated one. And we are going to see many more pandemics in the future. So we need to make certain that we take all the precautions properly. So during this COVID precautions, you will have to encourage your patients. You'll have to tell them that they will have to use their own transport. They should avoid a public transport whenever possible. They should try to schedule their appointments in such a time that they don't wait in the hospital for a longer time. You should not ask the patients to wait early. Normally, we ask the patients to come early, wait for some time before they are exposed to us. So that has to be avoided. We'll have to make sure that they come only at the right time and the waiting time is reduced. And if at all, you can minimize the face-to-face contact, either by using a telephone or video consultations or having a home delivery of things. You are having a home checkup where you can just go to the home for a blood collection. That would be better rather than coming to the hospital. Within dialysis, just make sure, or within a hospital, you should make sure that almost all the patients and staff are having a mask. So that you should ensure that there is a universal mask use in the institute per se. You're going to have a separate treatment protocol or a screening protocol where patients suspected with COVID are going to be screened separately and stored separately. And anyone who is asymptomatic also has to be screened from time to time to understand the community prevalence. And you're going to ask the patients to have a sanitization protocol and to reduce common transport always. So with regard to dialysis per se, the Ministry of Health and Family Welfare has told that The dialysis technicians will have to wear a 3-layered surgical face mask. PPE has to be worn even for suspected patients, and a sleeved plastic apron has to be used. Whereas the NHS of UK, it has told that for any individual who is taking care of extremely vulnerable group, like those in dialysis, ICU, or anyone who is admitted in the hospital, make sure that the care provider wears a disposable glove, a plastic apron, and a surgical mask. This is a basic minimum requirement which is possible. And if at all you're going to see a patient with a respiratory infection, then you should make sure that an N95 mask is used. Then you will have, the most important component would be that you will have to educate the patient and the caregivers. Because once the patient and the caregivers are educated, the risk of infection transmission is reduced, both for the patient and from the patient to both for us and to the surroundings. So any fever, cough, expectoration, they will have to inform you. For a dialysis patient, any issues with the dialysis whisper, they'll have to inform you. And you will have to teach them about hand hygiene, about the vaccinations, and about any complications which can happen with the dialysis and other procedures which they will have to undergo. So just to recap, the key safety practices which has to be followed would be that you may perform your hand hygiene frequently, change your gloves. Whenever you are working, have a separate clean area and a contaminated area, even for sampling and for storing samples. Make sure that you handle the patient's blood, samples, and other items properly, and you deliver it properly for different patients separately. Try to clean and disinfect almost all the surfaces with which the patient and the healthcare provider come into contact. And whenever you are accessing vascular access in critically ill patients, make sure that you avoid contamination. You should make sure that you use a aseptic technique every time you come into contact. Infections are serious, but they are mostly preventable, and prevention and infection is everyone's responsibility, right from the hospital administration to the sanitation worker. It is a shared responsibility. We all have to do it properly, and it is a healthcare worker like you who will have to follow the precautions and safety measures, and that is the key to prevent both the spread of infection in the community. And there has been an article recently about healthcare worker safety in Lancet also, where they have told that there is no patient safety without health worker safety. So ensure that you are safe so that your family is safe as well as the patients are safe. Thank you.
Thank you, Doctor, for giving such a clear-cut explanation on safety measure practices during clinical practice. And now the question and answer session begins. I request the audience to raise their questions in the chat box. Participants who are having any questions regarding this session may raise your questions in the chat box now. Sir, there is a question, sir.
Yes.
Sir, is there any statistical reports regarding which healthcare provider is more prone to this hospital infection?
So probably this varies with the type of infection we are speaking about. So if at all your query is with regard to COVID, it was seen that the nursing staff are the ones who got more commonly infected. This was probably because they were the ones who had come into contact earlier with the patients, both in the emergency as well as in the patient care area. So with regard to COVID, it was the nursing staff. However, for other infections, consider that any infection happens in a dialysis unit. So it is a closed unit. I usually take an example of dialysis unit because I'm probably more used to it. So in a dialysis unit is a closed unit. So in a closed unit, it will be the dialysis technicians, the lab technicians in the dialysis unit. We have a lab technician in a dialysis unit, and the nursing staff in the dialysis unit who are going to stay in the same room with the patient for at least 4 hours during the procedure. So anyone who is going to have a prolonged exposure to the patient is going to be affected. So if at all, consider that a person is taking ECGs for throughout the entire day, has taking multiple samples throughout the entire day. Obviously, because their contact with the patient is more, the risk of infection is more. So that is precisely the reason why nursing staff usually have the maximum risk of exposure. Otherwise, all of us, any one of us who is going to be in contact with the patient for a longer time, have an increased risk of exposure.
Participants, write your questions in chat box.
Sir, another question, sir. What is the most omitted safety measure by the lab technicians?
So what we have noticed, or what even the data says, would be that the fact that I think most of the lab technicians you all tend to have a lab coat where you try to keep all your supplies in the pockets. So that is something which you will have to avoid. It may be easier for you to just take something out of the pocket, take a blood sample or do something. But you should remember that even if you wear a gloves, as you're going to touch your top pocket, once you're going to finish your day work, you're going to remove your lab coat just like that, and you're going to hang it somewhere. So that is something where the infection can spread back to you again. So make sure that you don't carry lots of things in your lab pockets. Try to keep it separately, one. And two, you will have to change your gloves frequently and perform hand hygiene frequently. It becomes difficult. Probably earlier we never used to tell that for every patient you will have to change your gloves. But right now you should understand that you never know which patient is infected. So it would be better if you could change your gloves on for every patient separately. Probably these are the two things which would probably help you to prevent infections among yourselves and also among other patients.
Participants, can you write your questions?
Sir, the another question, sir. What is the main safety measures need to be taken by operation theatre and anesthesia technician?
With regard to the theatre technicians, and anesthesia technicians, one good thing would be that they're obviously in a scrubs already. So obviously their clothes are not the mode of spread of infections. For them, the proper PPE is what is more important. So if at all there is any aerosol generating procedure, anything with regard to the airways are being exposed, especially for anesthesia technician and OT technicians in regard to places where a general anesthesia is being given, those areas they should make sure that they're having proper PPEs with regard to, especially N95 mask has to be used obviously in the present scenario, and a face shield and a complete PPE has to be worn by them. And we usually forget that even the orthopedic procedures, we think that orthopedic procedures may be safe, but orthopedic procedures also generate lots of aerosols. They should be certain that those aerosols are prevented. So a proper N95 with a PPE should help them.
Yes, sir. Next question, sir. What is the most common infection transmitted to the health workers?
To the health workers is usually a respiratory infection. Till now, the most common infection used to be only the common flu. Considering that flu is by droplet infection. So whenever we are in the same room as a patient, the flu used to be transmitted. The good thing about flu is that most often the flu is going to be either mildly symptomatic or is going to have very few symptoms. It is just like a common cold. So that is basically the reason why we have not understood its importance. COVID also is spread in almost the same manner, but because COVID is very serious, that is why we have started understanding how important is this healthcare transmission. So flu is the most common thing which is transmitted, and we should remember that healthcare workers are probably one of the closed group of workers for whom even TB is more common compared to the general population, because we are not knowing with which patient we are going to come into contact. So the respiratory infections are most common, especially flu.
The next question, sir. Is the current COVID situation pushing the healthcare workers to follow an OT protocol to perform even a simple procedure, sir?
The thing is, all the simple the OT protocols have to be followed always. The only reason we have not been following it because we were always assuming that we are safe. We are not going to get infected. And one and two, considering that our country is a very vast country, it still has some implications of cost. We don't perform protocols for everything because we are trying to cut down on the cost basically. And with this infection like COVID, where we have seen that if you are not going to follow the protocols, the risk of infection is high. The idea of following protocols has come. I think we should rather use this as a starting point and use protocols always, so that we stay always, because we will never know when we are going to get any infection. So this is for our own safety. And by saving some money, by not following protocol, I don't think we are going to benefit anyone else. So more safety we use, though it is time consuming, though it is more costly for the hospital per se, I think it is better for us to follow the protocol even for a simple procedure always.
Next question, sir. What is the common mistakes done by the dialysis technician in their safety measures?
So the common mistakes done by dialysis technicians in the safety measures. See, the most common would be the problem is not for the dialysis technician per se, it is for the patient. So we've seen that catheter associated bloodstream infection, CRBSA or CLA-BSA, what it is called as CLABSI. It is a most common cause of mortality and morbidity among dialysis patients worldwide. And the catheter infections happens, okay, accepted, it can happen even when the patient is not very neat. It is usually it happens usually because it is a dialysis technicians will access the catheter hub without the proper aseptic precautions. One. And two, usually the aseptic precautions are followed when the dialysis is being initiated. However, between dialysis, when they are going for some other patient or coming back, the precautions and the personal protective equipment or the hand hygiene won't be done, and they just tend to touch the patient again. This is where the infection happens. And this is the most common reason where patient will have a failed vascular access, will start developing CRBSA, and this is something which can be avoided always. So this has to be taken care of. One. And two, in the present scenario, we should make sure that all the dialysis patients tend to wear a mask. Because if they're not going to wear a mask, then they can transfer the infection to you. So this is some time where we should make sure that we bring in a protocol that all dialysis patients always almost wear some mask in dialysis.
So, another question, sir. Except corona, what are all the infections occurs through droplet and airborne?
So with regard to droplet and airborne, any respiratory infection is going to be so. The most common worldwide is flu, the common flu, which is caused by influenza virus. The previous H1N1 pandemic, H1N1 influenza flu had happened around 10 years back, almost all over the world, something like a smaller version of the COVID flu. So that was transmitted by this. Tuberculosis is also transmitted. Even varicella, chickenpox is transmitted. Measles is transmitted. So almost all the viral infections and respiratory infections like pneumococcal and airborne.
Okay, sir. The next question, sir. Sir, during this time of COVID-19, we heard a lot about mental health. How are healthcare workers affected mentally by this epidemic and how can they overcome it?
Okay, so ideally what data or statistics had shown was that around 1 in 4 healthcare professionals, around 25%, have been affected by some mental health problem. And probably I'm not going to speak more about it because I think our next session will be dealt by Dr. Venkatesh on the same topic. So I think that would probably be helpful to know more about mental health and protecting us.
Next question, sir.
About critical
What
care.
are all the
Yeah.
what are the common mistakes done by the critical care technician in their safety measures in ICU?
So with regard to the ICU, one problem would be that the patients are either in a ventilator or they are on a CPAP, the continuous positive airway pressure mask and other things. The problem is for those who are having respiratory illnesses. If they are on a ventilator, it is fine because usually the expiration, the expiratory air goes through a filter and comes out. When the patient is on a high flow nasal mask or is on a non-invasive ventilation like a CPAP mask, then the expiration is directly into the environment. The risk of transmission of respiratory infection is high. So the critical care technician can't do anything basically to prevent this, but they should make certain that whenever they come into contact with that patient, they will have to make sure that they wear the proper mask and use proper hand hygiene one. And they should also make sure that the patients who are not on ventilators, who are having a direct exposure to the environment with a respiratory infection, they are away from the other patients by at least 3 to 6 feet. By doing this, the infection or cross infection between patients can be prevented. All the critical care patients are going to have central active venous catheters. So the same guidelines what we use for dialysis catheters have to be followed for the central vein access also. No cross touching, always hand hygiene before touching is important. This is what they'll have to follow. And the critical patients, as the name suggests, they're very critical. So if they're going to get any more hospital acquired infection, they may not be able to survive. And the most common cause of hospital acquired infection is cross contamination. So they will have to make sure at all counts, on all accounts, that they don't use the same gloves for 2 patients in the ICU for anything. They should always change the gloves and they should always perform the hand hygiene. So however, how much ever we speak about different scenarios, be it the OT, dialysis or the critical care, the most important thing would be that perform proper hand hygiene, change gloves frequently, and you're going to get prevented against infection. Both you're going to get protected, they're going to protect patients also.
The next question. During COVID, what safety measures healthcare workers fail to do?
Okay, there are two parts of this. One, healthcare workers failed to do, and 2, healthcare workers were not provided also. So during the early part of the pandemic, what happened was that there was a complete dearth of N95 mask, proper N95 masks. The normal masks, though they are effective, when you're in close contact with the patient, especially affected patients, it used to spread. That was one. And 2, we didn't understand that COVID was spreading through contact. Initially, it was thought that just like the normal flu spreads only through respiratory or the droplet. So just like the normal flu, COVID is also transmitted by only respiratory is what was thought. Then we understood that even by simple contact, it spreads. So by the time we understood it, the spread of infection was very much high. That is precisely the reason why healthcare workers were very commonly affected by COVID in the initial days. However, once the supplies for masks and gloves improved, proper PPE kits were there, our understanding about COVID improved, then I feel that the safety of the transmission risk reduced significantly. So it was more of a knowledge gap, and with time, this knowledge gap had improved, and I think we are more protected against COVID right now. And obviously, one thing right now would be that vaccinate, try to get yourself vaccinated always. Whenever there is an opportunity, whatever be the vaccine, try to get vaccinated because there is going to be some benefit, if not complete ideal benefit, there would be some benefit. So you will have to get vaccinated. Then only you and your family can stay safe always.
Sir, another question, sir. What were the mistakes that you observed in BMW management which posed a serious threat to healthcare workers?
BMW is biomedical waste, I suppose. Biomedical waste management, right?
Yes, sir.
Sir.
Yes.
Yeah.
Yes,
So
sir.
with regard to biomedical waste, obviously the standard rules like any contaminated dressing or any contaminated syringes have to be disposed of properly. We have always seen that there is a mix-up between the contaminated and the non-contaminated waste always. So this has to be avoided, one. And two was that we usually try to wear the same apron the entire day. We try to wear the same apron the entire day. And with regard to COVID, it was seen that whenever the same apron is being used, whenever you're going to leave the area and come in again, you're going to transmit infection outside because there is a contact route which is there. So whenever you're going to leave an infected area, remove all your PPEs, change it, and when you're going to re-enter it, you'll have to use it again. And this PPE has to be disposed of in a separate cabin. A separate waste management for COVID has to be done in all hospitals. Apart from the standard red, yellow, green, what we use, we'll have to make sure that there's a separate thing for COVID per se. And every time you are going to leave the contaminated area, all your PPEs have to be changed. So that has to be taken care of.
Other final question, sir. Some patients used to change their hospital environment. At what percent does it regards with the hospital hygiene?
Some patients change their hospital environment means they are changing between hospitals, or sorry, I don't know if I'm able to understand this question. Probably you can allow them to speak.
Yes, sir.
Gibson, can
Hello,
you
sir.
explain this properly?
Yes, sir. Hi, sir. My name is Gibson. I have this question that some people tends to change their hospital environment for treatments for so many other reasons. But what percent they are changing for hospital hygiene? Like they don't know, like the hospital hygiene is not proper, so they are changing. So what percentage that could be? They are changing because of the hospital hygiene.
See, I think that hospital hygiene should be a very important reason why patients shift. I don't know the statistics per se about what percentage shifts, but the basic thing is that the one reason why probably government hospitals have not made it big in India would be that the hospital hygiene is not good. So even those who are having monetary issues, they tend to prefer private institutions because the hygiene is maintained. That is the most important reason. Otherwise, we still understand, we still say that government doctors are good, but still almost all our families or anyone, they always like to visit only a private setup. So the most important reason is only hygiene. And whenever there is a chance and whenever they can see that they are going to get better hygiene at either the same cost or only at a slightly increased cost, I think the patients are going to change. And if at all I'm going to pay only, this is the same for us. Like we will obviously like to go in a better bus or a better flight if at all we are having the money for it. So more money, you will want better hygiene, one. And even for the same money, you will want if there is an opportunity that there is a place with a better hygiene, you will prefer it. So that irrespective of whether it is a hospital environment or non-hospital environment, I think that is what we expect.
Thank you, sir.
Thank you, sir, for accepting our invitation and made your presence in the great national conference and brought us about the knowledge and safety measures during clinical practice. Once again, thank you, sir.
Thank you. Thank you for the opportunity.
Thank you so much, sir. Thank you so much, sir.
Thank you.
I request the participants to please switch on your video and to be on mute. Now, we are moving on to the most exciting student digital e-poster display. Over to the team. Thank you, team. I would like to invite our faculty, Mr. Vinod Kumar sir, to introduce our guest speaker, Mr. Venkatesh, the speaker of the next segment on the topic mental health care for healthcare professional. Over to you, sir.
This is my privilege to welcome our guest speaker, Mr. Venkatesh, Professor in PG, Department of Social Work, Ramakrishna Mission, Vivekananda College, Chennai. He is a founder, director of Niyamita E-Counseling Private Limited, India. He is completed VSc in Zoology, New College of Science, Master of Science in Social Network and specialization in Human Resource Development and Labor Welfare. MPhil in Labor Management, Madurai Kamarajar University, and he is organizing the Niyamita, a new generation e-counseling model for individual facing social changes by providing a counseling service to individual in a customized manner based on the insight in their personal characteristics and problems. I would like to invite you for the conference, sir. So over to you, sir.
Good morning to learned and practicing professionals and budding learners. Every word during yesterday's inaugural speech of our management members, Honorary Secretary Mr. Philip and Mr. George Cherian, Administration Director, Principal Dr. Deepa Philip, and Head of the Department, Microbiology Department, Dr. Anusha Rohit, reflected the need of holistic wellness for health professional fraternity. By conducting this national seminar on the theme proves their words in action. This initiative will go a long mile at individual level and to the fraternity as it is the need of the hour. Sir, slide, sir.
Yes, I'll share some.
So whether the slide is working?
Yes, sir. Yes, sir. Just a minute. Just open.
Thank you. Let me continue back. My session part is to reiterate the importance and the ways and means to protect and enrich the emotional needs and well-being of the frontline health workers towards maintaining a harmonious work-life balance. Next slide, sir. National Institute of Mental Health and Science, NIMHANS, along with UNICEF, has come out with the information manual for psychosocial care for frontline healthcare workers during COVID-19, in which the specific stressors that are particular to the people within frontline fraternity is addressed. It is expected for the affected individuals, both directly and indirectly, to feel stressed and worried. Some of these fears and behaviors are realistic, while many are just born out of lack of knowledge, rumors, and misinformation. Our management are conducting this seminar only to break this barrier. Next slide, please, sir. As we are aware of COVID-19 as a pandemic and it is outcome at medical level, infomedic is also one of the outcome of any pandemic at social level. Yes, unbelievable information spreads far and wide. Many misinformation is an outcome of lack of basic knowledge and easy spread of rumors. Few caused due to personal interest of such, you can keep in the same slide, sir. Few caused due to personal interest of people too. These becomes the stressors, thus placing every one of us in a vulnerable situation. A sort of insecure feeling, creating anxiety and stress is due to this infodemic. Next slide. Every one of you, when on duty, are working in the line of danger for the sake of common good to the people. Sir, you can go to the slide, sir. This is the first slide. Yes, sir. Thank you, sir. Every one of you, when on duty, are working in the line of danger for the sake of common good to the people. The very purpose of patriotism, in spite of knowing what every one of you are undergoing by yourself, is only to enable and empower you to put the knowledge and skill to action. Yes, the stressors are created by the unverified news and incidents that put you in vulnerable state and mental and emotional level. This state has to be dealt with by coping mechanism of self, which determines self-capacity to recover quickly from difficulties and portray toughness. Yes, that is all about resilience. Sir, next slide, sir. Let's go into deep about how the stress affects us. In the context of COVID-19, it is possible that a frontline healthcare workers would feel anxious about having contracted the virus and the possibility of him or her in infecting his or her family and loved ones. Continuous exposure to critical work setting can instigate anxiety. Anxiety may in turn lead to the worker finding it difficult to sleep. This is often accompanied by a deep sense of emotional exhaustion. Their family members' fear and anxieties add on to the pre-existing turmoil. the daily routine of the person within family contacts would change. The frontline healthcare workers would be expected to work on a war footing and would get to spend very little at home. This would lead to strains in the roles and responsibility of all the family members. Some of the frontline healthcare workers would even have to stay away from the family, either due to work or quarantine due to exposure. Next slide, sir. Bereavement, which means a loss of loved ones. The grief resulting is continuous stress, which at higher level takes to depression and so on. Next slide, sir. Some of the mental illness seen among frontline healthcare workers, and it is commonly observed symptoms are adjustment disorder. Adjustment disorder have got the symptoms of sadness of mood, anxiety of worry, fear of contracting an infection, or a combination of all these. And continue to it, persistent preoccupation with illness worries, inability to cope up, and some degree of dysfunction in their daily life. Sleep and appetite disturbance. They may not be having a proper sleep and also hungry to have the food. In adolescent, these symptoms might be associated with oppositional behavior of transit. Depression disorder is another illness which have got the symptoms of low mood, decreased or loss of capacity to enjoy things. They may not feel liveliness in their life, in their day-to-day routine performances. Decreased energy will be seen in the with the individual, and sleep and appetite disturbance, as in the earlier case, marked tiredness after even minimum effort, not due to any medical cause, including COVID-19. Reduction in activity or feeling restlessness, lowered attention or concentration, a complaint of poor memory. They lose concentration, thus the memory is really become weak, and loss of self-esteem and self-confidence. They just be mechanic, monotonous, but with the fear occupied in their mind always. Ideas that one is worthless or has done something wrong. Feeling of helplessness, no help will be available, as it is destined is the feelings they get in their mind, and that there is no hope for their future. Death wishes or suicidal thought or attempts. I may not be exaggerating with all these things because it is not easy task for seeing people dying very often in their duty time, right? And another disorder is substance use disorder. Those who are having an habit of consuming alcohol or tobacco, or they're prone for this illness. This substance disorder have got the symptom of increased use with some dysfunction in daily activities, continued use despite physical, social, and mental harm. Strong desire to drink and smoke, difficulties in controlling the use of drinking habits or smoking habits, persistence of drinking or smoking despite obvious harmful consequences. They know, they realize, but still they may not be able to control it. Higher importance given to use of substance than to other activities. Increased tolerance or smoking or drinking more to get the same effect. Physical withdrawal state or strong physical symptoms when stopping to take it. Generalized anxiety disorder is another illness and got the symptoms of persistent nervousness, tension, restlessness, or feeling on edge, irritability, muscles feeling tense and tight, poor concentration, sleep disturbances, physical symptoms such as excessive sweating, feeling in light-headed, palpitations, dizziness, and stomach discomfort. These are all the symptoms for the generalized anxiety disorder. The next follows is panic attack, which have got the symptoms of recurrent unexpected attacks of severe anxiety. A panic attack that reach a peak within a few minutes and last for a few more minutes. There is associated fear of having more attacks, and they expect, whether they get or not, their expectation in their thought level will make them worse. And it is unavoidable avoidance of triggers of panic attacks. Many of them might feel that they are about to die or lose control or go mad and will end up in medical emergency settings. Another illness is phobias, which have got the symptoms of irrational excessive fear of crowds in the wake of COVID-19 due to fear of infection. In certain cases, if there is excessive avoidance of crowds to the point of being housebound, it is called agoraphobia. They just isolate themselves in their room at their house. Okay. Another is anxiety symptoms heighten around the situation, causing phobia accompanied by avoidance. The next illness is called obsessive compulsive disorder, which is popularly, we will term it as OCD, which have got the symptoms of repetitive, distressing, intrusive thoughts that are not in keeping with person's standards of knowledge. Associated actions that seemingly relieve the tension. A common example among frontline health workers is that they are contaminated and wash repeatedly to reduce anxiety. It's a compulsive disorder. Okay, so compulsively they just go on washing their hands and wash repeatedly to reduce anxiety. Okay, they often recognize that these thoughts are senseless but cannot control them due to fear of contracting COVID-19 through transmission. Such a persistent fear is likely to predispose to severe OCD in some otherwise vulnerable individuals. And in these cases, washing can persist for many hours in a day with significant distress and dysfunction. Another one, illness is called a severe mental disorders. The level of illness, the height of it, when the height of the illness, mental disturbance comes, the severe mental disorders is observed. The very symptom of this illness is unexplained irritability. They behave very aggressively, talking or smiling to self. There may not be any reason, but still they find something interesting, or they smile to themselves and they speak to themselves. Unreasonable suspiciousness, hearing voices when nobody is around. They alone will be able to hear, and they will be in their own world, which we will call it as hallucination. They will be speaking. They will be in their own world, that they be interacting with people. Okay, and their fears and their they respond to their mind, which makes the world for them. Then false belief, that is delusion, and poor self-care. Next slide, please, sir. Sir, next slide, sir. Yes, having seen about illness, general awareness. This slide is just to create a general awareness to the participants. The illness are assessed. The way of assessment, the level based on the level of assessment, the interventions can be given. So, because this assessment will be done only by the professional who are practiced for it, like psychiatrists and social workers, medical social workers. This is just to create an awareness among the audience. The slide is prepared. There are perceived stress scale. For anxiety, we have got a scale called generalized anxiety disorder, GAD 7 we will term it as. And for depression, we will call it as PHQ-9, that is Patient Health Questionnaire to measure depression, and ISI, Insomnia Severity Index, to assess the extent of sleeping trouble. When we have seen in the earlier slide, we have seen the disturbance of sleep and appetite in almost all the illness. So this Insomnia Severity Index assessment will be popularly assessed and evaluated. And we have self-reporting questionnaire. We have a self-reporting questionnaire, which is a general tool to understand health condition. Based on the assessment, then the intervention can be given to the individuals. Okay. So next slide, sir. All frontline healthcare professionals have been affected adversely during the COVID-19 pandemic outbreak. The mental health of all the workers need to be kept at optimal level in order to continue to effectively disperse their duties and responsibilities at individual level. A breathing exercise can be practiced. So this is an intervention slide. You can really, get into this. This will be very helpful, and this is the very purpose of this national seminar. So, because whatever the problem we have mentioned, I have highlighted, is undergone by every one of you and me. So, as an intervention at basic level, we can practice, we can get to know about it, and we can do it. No? Breathing exercise, which you can begin with just 5 minutes a day and increase your time as the exercise becomes easier and more comfortable. If 5 minutes feels too long, start with just 2 minutes and then practice it. Make yourself comfortable, and then you can go to 5 minutes and 10 minutes and so on. Practice multiple times a day, scheduled set times, or practice conscious breathing as it is needed. Generally, 3 types of breathing can help to reduce this fear, or to reduce the stress. The first one is pursed lip breathing. To do it, you have to relax your neck and shoulder, keep your mouth closed, inhale slowly through your nose for 2 counts. Slowly through your nose for 2 counts. Or purse your lips as though you were going to whistle, and then start exhaling. Exhale slowly by blowing air through your pursed lip for a count of 4. So as you have inhaled for 2 counts, you are going to exhale it. As you are going to exhale it very slowly, you have to exhale the air for the count of 4. Then next is breath focus technique, where you are going to concentrate on your breath. This deep breathing technique uses imagery or focused words and phrases. You can choose a focused word that makes you smile, feel relaxed, or that is simply neutral to think about. Example include peace, let go, or relax, all is well. Okay, so like that you choose your word and just concentrate on that. But it can be any word that suits you to focus on and repeat through your practice. As you build up your breath focus practice, you can start with a 10-minute session. Gradually increase the duration until your sessions are at least 20 minutes. I'm just talking about 10 minutes breathing, 20-minute breathing and concentration. It is not an easy job. It is not an easy job, because the level of assessment is going to affected level of affection is going to determine the practice to make this, to do this focused breathing. You have to sit or lie down in a comfortable place. Bring your awareness to your breath without trying to change how you are breathing. Alternate between normal and deep breath few times. Notice any differences between normal breath and deep breath. You have to notice it. You have to concentrate on your inhale and exhale. Okay? Notice how your abdomen expands with deep inhalations. Note how shallow breathing feels compared to deep breathing. Practice your deep breath for a few minutes. Place one hand below your belly button. Keep your belly relaxed and notice how it rises with each inhale and falls with each exhale. You must do it with full concentration. That is what all about. Okay. The other third and final one, which is, I'm just talking about very basic breathing exercise, which is the third one is diaphragmatic breathing. Belly breathing can help you use your diaphragm properly. Do belly breathing exercise when you are feeling relaxed and rested. Don't do this when you are working or while you are performing your day-to-day activities. Do it, find some time and do this exercise. Do belly breathing exercise. This will really work out and give you a relaxation. Practice diaphragmatic breathing for 5 to 10 minutes and for 3 to 4 times per day. It is not necessary that you have to do this breathing at a stretch of 15 minutes. You can take it, just spread 3 or 4 times in a day and practice it, so that you will be you will be able to make it very conveniently to yourself. The next one is mindful meditation. Mindful meditation. Mindful meditation is another technique where you will be able to relax yourself and reduce the stress and the stressors which create stress to you. Mindful relaxation, mindfulness sitting meditation with breathe as the primary object of awareness, arranging to spend the time in a comfortable but attentive posture. Preferably sit up without leaning back for support. If you are mid-40s or you are not able to sit very on floor, you can just sit erect in a chair where you can rest your spinal in an erect manner. Okay, but ensure that you are sitting without leaning back for support. Okay? If that is possible for you, and make it possible also. Okay, to take the best out of your exercises. And at time and in a place where you won't be disturbed, sitting in a dignified posture, head balanced on shoulders, arms, and hands resting in a comfortable position. This is a time for allowing ourselves to switch from our normal mode of doing and moving and reacting to one of simply being. Just being attentive to what's happening within your own awareness, right here and right now. You have to be, mindful of what you are doing. You are going to be as you are, but you are going to be very consciously going to do that. That is mindful sitting is all about. And as you sit, just noticing sensation of breath. Just notice how your abdomen moves on each in-breath and out-breath. The movement of air through your nostrils, a slight movement of chest and shoulders, just bringing you awareness to whichever part of your breath cycle and whatever it is the most vivid. Whether it is your tummy or your chest or your shoulder or the movements of air through your nostril, just mind it. Mind it with consciousness. This will definitely relax you. This will take you from your worries, and with the 5 minutes of relaxation will go a long mile to come up from the stress and stressors. Noticing the entire cycle of breath from the movement of the air, of the air coming in and filling the lungs and extending the abdomen slightly, the movement of air going out, and being aware of the pause, the stopping point in between the in-breath and the out-breath, and the out-breath and the next in-breath. It's all one movement, but you are going to do it because you are going to do it consciously. This is going to give you a relaxation. Okay, you will feel this as there is something easy for someone, but for someone may feel that no, it is not going to work out for you. But whatever the impression you are getting right now, but please make it in a practice and do it. You will see the result. The result is going to make you make you practice it in your day-to-day activity. You will notice the attention from time to time shifting away from breath. You will not be able to concentrate because you have got a persistent worry in your mind. So when you are just trying to shift and concentrate in your breathing, it is not going to leave you. Definitely it will not going to leave you. So you will have a shifting. You will not be able to concentrate. But the consistent practice of this mindfulness breathe is going to ensure that the shifting, the shift away of your thoughts will reduce, and you will see the result. So the mind may wander into fantasies or memories, thoughts of the days, worries that you might have, things you need to do. And without giving yourself a hard time, when you notice that has happened, gently but firmly bring your awareness back to the sensation of breathing. So every day on your duty time, it is not going to be an easy cakewalk as earlier. You are going to see so many death or so many sufferings, people struggling for breathing, etc. This worriness creates an insecurity, security, and preoccupied with the same thought that has to be broken by doing this exercise. Okay. The next one, mindful breathing practice, meditation. You have got progressive muscle relaxation. The progressive muscle relaxation is a method that helps to handle physiological arousal, that tension. In progressive muscle relaxation, you tense a group of muscles as you breathe in. You can see when you go to a gym, there will be every gym bodybuilders are not coming only for making their body tuned. There are people who just come and they just do as an addiction. They just lift the weight enormously. Okay, this is a coping mechanism. They just take it. Okay, so this muscle relaxation technique is one of the coping mechanism. Okay, this by adapting to this coping mechanism, you are building the physical health better and better. So as it is constructive, you can very much practice this progressive muscle relaxation technique. Relax them and breathe out. The techniques involve alternative tension and relaxation. In all of the body's major muscle groups, you work on your muscle groups in a certain order. This is based on the theory that when your body is physically relaxed, you feel less anxious. When it has to be relaxed, when it is over tensed, then it starts relaxing. When the relaxation starts, your anxious become less. So this is the very purpose of muscle relaxation technique. And to do this, I hope I have got more time, so I can just go through this technique also, how to do this. Make sure you are in a setting that is quiet and comfortable. Okay. When you tense a particular muscle group, Do so vigorously without straining for 7 to 10 seconds. You may want to count 1001, 1002 like that, and so on as a way marking of seconds. Concentration on what is happening. Feel the build-up of tension in each particular muscle group. It is often helpful to visualize the particular muscle group being tensed. When you releases the muscles, do so abruptly and then relax, enjoying the sudden feeling of limpness. Allow the relaxation to develop for at least 15 to 20 seconds before going on to the next group of muscles. You can very much observe this in gym. So people who exhaustively put weight, after 3 minutes or 5 minutes at that count, they will not be able to even get up from that bench. I hope many students will be going for gym and they will be witnessing this scene, whatever I'm explaining. So when an exhaustive weight is beyond that limit, for some it will be even 50 kg is an exhaustive weight. For some it is even 500 kg is that it may be the exhaustive weight. So based on the individual, when you try to do it, the muscles get tensed. So when you suddenly relax it, you will not be able to even get up and get out of the bench itself from the gym. So yeah, numbness will feel, and then started relaxing, where your worriness or whether your concentration on your day-to-day pressure, stressors will go up. And this is very constructive because you are building your physique. And when all these things, as yesterday's second session where madam was talking about a nutritional practice, when you supplement this exercise with proper nutrition, then you are taking this COVID-19 situation in a very positive and constructive manner. And you will start enjoying, instead of worriness, you will start enjoying it as you are going to see only the positivity at every level. Once you are comfortably supported in a quiet place, then do all this exercise, because when you are already in an that's what the assessment matters. When you are in a serious mental illness, you may not be able to. When an hallucination level the individual is, they cannot be practicing this. This is a very basic exercise. These exercise I am just recommending only for the beginners and for the one who feel the heat right now. Or if already felt, please consult the professionals, and according based on the assessment and the level of symptoms, they will be helping you with appropriate techniques. Then comes is loving kindness meditation and self-care tips. See, anything you must feel purposeful. So when you self-care yourself, then we will just dress up and when we want ourselves to be attractive, when we find our life interesting, when our education and our knowledge, everything is given only when everything is going to come to help when things are going against. So when it is an easy flow, when you dress up, when you are enjoying, it is not a big thing. It is not at all a big thing. When everything goes wrong, but still you just said what you are. That is what the education or the awareness, the purpose of this conference gets fulfilled. So take care of the self-care tips. Before I am going to loving kindness meditation, let me just tell you few tips routine life, okay, which is purposeful, and ensure breaks and adequate sleep. Have minimum sleep a day, okay. Ensure that you are sleeping, okay, because the sleep, if if the dysfunction of day-to-day activity will definitely disturb your sleep and appetite. So ensure that you eat properly, nutritious food, and you are having a good sound sleep, and keep in touch with relatives and friends. Make the days lively. Yes, of course, we have to stay away. We have to maintain social distance, everything. It doesn't mean that you have to cut your social relationship, because human being is a social animal. Okay, it is a very basic characteristics of the human. He is a social animal. So socialization should not be cut off at any time, at any level. So maintain social distance, and we have so many tools for reaching people. So keep in touch with relatives and friends, with with your with your love and care. Just relate to them. It speaks a lot. Okay, not just for the lips. Stop having the lifestyle for your pay for your at your lips. Please come out from all those and ensure that you are relating to people from your heart. Okay, carry out some activities and hobbies unrelated to work. It is not that your students, as you are all budding professionals, yes, you have to fully concentrate on your studies and equip yourself, because this 2 years or 3 years study or 4 years course is going to going to determine your 35 years of career life. Definitely, you have to. But in this pandemic situation, if the over commitment will make you monotonous, boredom. This results in outbreak, exhaustion. You will feel exhausted, and then at one point of time, everything will be broken. So just do it. Do something. Whether you are going to cook at in your house, it's also because you are going to cut. You are going to break the normal course of the thought process of your mind. So do anything. It is need not that you have to again go out and play and you have to be on ground. No, not at all. Whatever unrelated to your work, but do it with passion. And when you are doing it, enjoy it. Because it is now addressed in the conference, you should not go and do it because it is as an exercise. No, choose the exercise which suits you and which you enjoy and do that. Then the result will be very much good. Next is exercise regularly and have a healthy diet, which I have already spoken when I'm covering the second point, to have adequate sleep. And the next one is practice relaxation exercise like those mentioned above, or yoga, which I have already spoken about. I also mentioned 3 techniques, breathing techniques. So relaxation, breathing exercise is a good relaxation technique, and do yoga, do meditation, okay, and do it you are not going to, you don't have a mind that you are going, if you are going to be a master in it, you are going to reap the benefit out of it, not at all. Even as a beginner, without any guidance, just you have got a Google Guruji, so you just try to Google it and try to practice it. When you find the fruit from those exercise, it will take you to make yourself perfect. But start doing it. But do it. Do it. Don't be always very professional. Don't look for 100% perfection in anything. And next is religious activities. Be spiritual, whatever it is. Okay, do it very religiously. And if people are no religious person, go to temples, mosque, or church, where you will definitely have a good vibration. which will help you to relax, relax your state of mind, and it will be a positive thing. Then make time for yourself and your family. It is more important. Once again, I am telling you, social animal, human being, we are social animals. We cannot be very much target oriented, logical in thinking. Okay, it is not going to take us anywhere. It is only your kith and kin is going to make your life successful one. So do not avoid it. Make time for yourself and your family. It is not necessary that you have to go to an extended family circle and find meaning of it. Just as an inner circle, kith and kin, that's enough. But make it. Okay. Coming back to loving kindness and meditation script. Okay. So how to this kind of meditation helps the frontline health work professionals to reorient themselves to the purpose of doing the work that they do. This meditation will enhance the positive regards the frontline professionals as for themselves and others. Your profession is a very noble task, no doubt about it. Yes, you are guarded, and you have really taken ahead the human race ahead. But still, you have to do this with patience and love. Otherwise, you are going to be affected. You are going to be affected. How to love how to do this meditation? You have to be happy, see yourself, see happiness in yourself, and ensure by saying to yourself, okay, may I be happy, may I have ease of well-being. All this start now. Sit quietly and focus your attention on your breath, moment by moment. As you continue to breathe in and out gently, repeat silently. Okay, whatever the phrases you want to make it, you can make it. You can make it. Okay, do it very patiently and see happiness is reassured at mental level, and find a love and care when you are doing this. This will make your personality very compassionate when you are coming and doing your day duty. So this vibration, what you are going to set in, is going to be vibrated in your work environment, and this will have a definite positive environment and positive positivity in your work life. And there are, see, I am just concentrated more on my presentation at individual level, just to refresh and just to touch upon family level and social level. Family level, because family makes the people, okay. Marriage makes a man perfect, complete. Marriage makes a man complete. Okay, it's a phrase we generally say. So this family, to reassure your family, the whatever the tiredness or exhaustion you have got, burnout at your work life, you can just bounce back by spending a quality time at family. Okay, some ways that you can support your kids. It is not that only the family have to support you. It is by way of supporting your family members, you are going to become stronger. That is the uniqueness of family socialization, but not in any other socialization it comes. But it is only in socializing at family level this comes. Okay, supporting your own people, you will get strength of it. So remember, you though you have got a awareness, and though you have got the facts and figures, very updated facts and figures in your hand, in your mind. Okay, it is not necessary that it has to be informed to your people. Not necessary, because you are a professional. You know the demarcation. You know the when not, why not, why, so what, etc. But not all your family members are to that extent professional. So reassure them. Okay, stick to the facts and let them know to the extent they have to be known. They have to be known. Okay, take care of them, but reassure your presence. When you are there, nothing is going to go. Give that confidence to them. Empower them. Okay, don't leave them very ignorant also by educating or by creating awareness, by ensuring that in our earlier speakers also have mentioned new normal. Okay, the term new normal. Okay, nothing is new normal. Whatever you speak as new normal, just washing your hands, as a doctor, as a healthcare professional, you have been doing it. Just 20 years back, now recently everything disposal has come. 25 years back, a doctor in a clinic, in his own clinic, used to put a thermometer in a hot water and wash it, clean it, will ensure that it is free for the next to be used for the next patient. Okay, once the other patient goes, by the time he calls the other patient, the doctor itself was cleaning all those things. So the comfortability zone which we have come is now broken. Of course, the PPP, personal protective equipments which are disposable have come, but the usage, the practice of usage to set in. Okay, so these things will take time. It is only matter of time. Only matter of time. And this is going to be part and parcel of your professional life. So don't worry about all this. Okay, there are learned practitioners who is going to evolve and bring new invention, new discovery, whatever it is, practices. They will put practice and ensure that it all again come and make you comfortable to practice your profession. So empower each of your family members, maintain your own calm, don't get agitated. Whatever the burnout you have got in your work at work life, do not show it to them. Maintain your own calmness. Even if people of your own wife, your own children is avoiding you because you have to be in quarantine, don't get emotionally attached and don't evaluate their avoidance. Don't make it. Keep calm. They know, and everything is once again telling it's all matter of time. Engage them. Engage them. It need not that you have to hug them and take them to the mall or take them out for a ride. It is not that. Engage them purposefully so that this is the mindset of worriness is avoided or not taken to their children's mind. Okay, so engage them, manage their emotions. Okay, ask them to ventilate whatever they feel. Okay, confrontation and assertiveness must be there. Definitely, no doubt about it. When it comes to family, socialization, it can be overlooked. But ensure that your family feels safe and secure by your presence, by you continue to be in healthcare professional. That is very, very, very important. Beware, make them aware. Okay, filter and limit media exposure can be overwhelming. As I told you, infodemic. Okay, please minimize the exposure to media for the TRD rating. They may be or the political interest or the personal interest of any group. Okay, they can flash with very alerting sound and music, breaking news with very good vocabulary in English nor Tamil, whatever the language. Okay, but it is going to affect the mindset. Okay, educate the them routines. Please at family level, family routines have to be always ensure that family cohesiveness, oneness is always created. This will reduce a lot. And societal level, it is not in your hand or my hand. It is with the government, with the administrative people. Again, the responsible management like who have taken their part in ensuring that the health practices are at the workplace, and they want the whole fraternity to be healthy, and they are conducting this. So this kind of positivity and the proper self-aware, creation of self-aware for the professional has to be done at strategical level by society. Okay. Any doubts? I'm closing with this. If sir, any other slides that to be covered now? Sir, next. Yeah, I think this is the last. So thank you very much. If you have any doubt, sir, am I on time?
Yes, sir. We have a question answered on, sir.
Yes, sir. Yes, sir. Sir, if I'm open to take up question. If you want any questions, please raise. You can raise it even in vernacular languages.
I request the audience to raise their questions in the chat box. So your first question: consciousness about self, role, environment, relationship, program, planning for self and society, and spirituality may increase your mental health. Okay, that was a comment.
Yes, what Dr. Parameshwaran has told, that is what I'm trying to explain it all through this session. Be self-aware. Okay, be self-aware of what your profession is. That is the very intention of this national conference program itself. The first 3 sessions, they have educated it technically, okay, through the experts, and final session, they want to create a self-awareness at emotional level, the importance of emotional state of mind. So this is I go with the word of Dr. Parameshwaran. Yes, definitely.
So your first question: what's the difference between suicide and suicidal?
Suicidal is an attempt. Okay, suicide is an act. Okay, so suicidal thought will come. I want to but suicide is not suicidal. There is a minor difference. The suicidal attempt will result in suicide. Yes, if I am correct. If anything to be added by any learned practitioners, they can do add also. Any other question?
Sir, how can you talk a person out of suicidal thoughts?
Actually, suicidal, we can take this as a separate session. Nimans and are all health workers, mental health workers have got a strategy of community gatekeepers. Okay, so the fact is that the person who wants to attempt a suicide is going to leave before a sign that he needs an help. It's an alarm. He will be attempting a word of his helplessness to the surroundings. So awareness of people like health workers and social workers in the community must be a gatekeeper, where they have to bring the prospect, the vulnerable. I should not say this word prospective here. It is vulnerable person to the counseling session, and when you are counsel them, or when you interact with them and touch upon the suicidal thought, do not use the word suicide. Whether you are intended to, how you are going to, what is the ways and means, whether you are going to hang or whether you are going to take poison. So the community gatekeeper should not be using those words point blank to the vulnerable client, but they have to handle it in a they handle it in the way they come. Even discourage the usage of word doesn't mean that discourage of expressing their thought. It is this comes by practice, and this will come for any social purpose and health care purpose. Have you got it?
So your next question, what is meant by physician-assisted suicide?
I don't think physical assist is come again. Is this physical?
Physician assisted.
It has to be legalized, right? It cannot be done, and no physicians will do that.
So your next question, how can we improve our mental health?
That is what I was just talking about, intervention. In the intervention part in this session, to improve your health, mental health only, I was giving tips about breathing exercise, about, ensure that persistent worry, whatever it is not COVID-19 alone, it is whatever it is, whatever disturbs you from normal functioning, okay, that has to be eliminated. How to be eliminated? That individual coping mechanism, individual personality have to decide the coping strategy. Okay, the basic tips we have given is breathing exercise, meditation, yoga, and love and compassion. So these are all the things alone is going to make the environment, the life of the people meaningful. So ensure that the session which we are which covered the intervention part is practiced in the day-to-day life.
So your next question, how we control our emotional stress?
By self-awareness. You have to be aware of what disturbs you. It's quite simple. And that self-aware, it depends upon your personality. And every person is unique. The personal strength of the personality has to be built. If it is it has to be strengthened. We have to strengthen. But please ensure that you are self-aware of what is happening. And when you are self-aware about the problem which you are going to undergo, it is matter of time. You itself will evolve the result. You will evolve your own ways and means to come out of the problem. So self-aware is to be developed. See, actually, once again I'm telling you, the whole purpose of this national conference is to reiterate the awareness of what you are having. Do you think that even students are not aware of the technical knowledge which was dealt by other speaker or whatever I am speaking? Everyone knows what we are talking. But the purpose of conducting this conference is to ensure that almost everyone are overlooking our knowledge. We are overlooking our skill, okay, and preoccupied, and comes in a vicious cycle. So when these kind of reiterating programs, awareness program, ensure that this is practiced inbuilt in our own personality.
So your next question, how are healthcare workers affected mentally by this pandemic, and how can they overcome it?
I didn't follow. Please come again.
How are the healthcare workers affected mentally by this epidemic, and how can they overcome it?
Yes. Very good question. in yesterday's session, the first question was very emotional question was raised. That is, when the health workers become the doctor, if everyone remembers, the question was, the doctor have denied attending to the patient. He advised for COVID, and the 3 days they have kept and then started the treatment. He has not denied. He has not denied his professional service. But yes, he is very logic. He is so professional in treating them. But the fellow members, everyone is emotionally moved. It is the own employee of the doctor and son of own employee. So what? That should, as a doctor or as a health worker, it is you should not be attached sentimentally or relation-wise. There should not be any transference and counter transference also practiced, right? So you have to be very much emotional attachment, bondage to be reduced, to be very professional, to have your professional personality intact. Okay, got it?
Sir, your next question. Is it good to do multitasking, or is it okay to focus on just one goal in terms of career? And does multitasking gives burnout?
Multitasking is the ability of doing multitasking is seen as a person's ability, but it depends upon the situation. It all depends on the situation. If it is needed, you have to do multitasking. Your personality, or you have to be equipped to do multitasking. But every time a person, right from 5 days in his duty, if he do multitasking, he is going to break. Even if he is very much skilled, he is very much experienced. Yeah, consistent multitasking is not going to. Yeah, research we have shown that. Okay, consistently, even the person is able to do multitasking is not advisable. Okay, but as a budding professional, please be open, develop your strength. Okay, in your learning phase, try to be open and not try to do multitasking, because as you do, you are going to learn, because you are all a professional. You are not studying a theory, arts and science class there. Even science students are doing practical works. Okay, this not an arts subject where you just study and go. So what you study, you are going to practice it. What you are going to practice is going to create confidence in your delivery. So do multitasking to get to practice many things in the duration, 2 years of study duration.
Thank you, sir, for accepting our invitation and made your presence in this great national conference and brought us about the knowledge in mental health for healthcare professionals. Now, I invite Mrs. Aruna, lecturer of CHS, to deliver the vote of thanks. Over to you, ma'am.
Thank you.
Good afternoon to one and all present here. First and foremost, I give thanks to the Almighty God for wonderfully making this day. On behalf of M College of Health Sciences, Department of Life Sciences, it is a great honor and privilege to propose a vote of thanks on this occasion. First of all, I would like to express our deep gratitude to our chief guest speakers, Dr. Arun Kumar Subbaiah, Assistant Professor, Department of Nephrology, AIMS, New Delhi, and Mr. V. Venkatesh, Professor, BG, Department of Social Work, Ramakrishna Mission, Vivekananda College, Chennai, for gracing today's conference. Thank you, sir, for your valuable speech. It was a very interesting and informative session. I would like to express our profound gratitude to our principal, Dr. Deepa C. Philip ma'am, for encouragement, moral support, and guidance in conducting this conference to a great success. Thank you, ma'am. I would also like to thank my colleague, Ms. Lalli Hannah Luke, Senior Lecturer, for her great support extended towards the arrangement of speakers. Thank you, ma'am. My heartiest thanks to my colleague, Ms. Hema Rupini, Lecturer, for her moral support to our comparing desk. Thank you, ma'am. My sincere gratitude for my fellow colleagues and staff of M College of Health Sciences for their fullest cooperation and contribution towards the success of this day. Finally, my heartily congratulations and thanks to my beloved students of M College of Health Sciences and other colleges of Chennai and other districts for your active participation in this event. Thank you all. Once again, I thank everyone for your cordial and kind cooperation extended toward the successful conduct of this virtual conference. Thank you all. Thank you, everyone.
Thank you, ma'am. Now, I request the audience to rise for the national anthem. Over to the team.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंधु गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे
Thank you, audience, for your active participation. Now, the link for the feedback form of our two-day national conference will be sent to your individual email ID for the registered participants. For the participants who participated in the digital poster presentation will be receiving 2 certificates. Thank you all for making this national conference a huge success. Thank you all.
So once again, thank you to everyone. Thank you all. So now we end the session.